next speaker is Vincent DeMarco, or Vinny, as his friends call him, President of the Maryland Citizens Health Initiative Education.
Thank you, Joel, so much for this opportunity. I'm a big fan of Joel Siegel and Chairman Conyers. They're tremendous leaders on healthcare in the nation. I first want to say thank you so much to all of you and your members for the federal healthcare reform legislation. I know you've taken heat from the left and the right on it, but I can tell you that we in Maryland love the legislation, and we're ready to implement it fully and to work with you to make it happen. Governor O'Malley has created a coordinating council that meets tomorrow in Annapolis. And we're going to be presenting there on how best to fully implement the federal health care reform legislation, which we think is historic and landmark, and because it will expand health care to 32 million people, absolutely tremendous. What I'd like to talk to you for a couple minutes about is what we've done in Maryland over the last couple of years prior to federal health care reform, and how important the FMAP is to that. In Maryland, which was the richest state in the nation, just a couple of years ago, we were 44th in the nation in health care for adults. 44th, right there at the bottom. Our level of coverage for parents was 40% of the poverty level. In other words, if you were a family of 4 making $10,000 a year, the kids were covered, but the parents weren't. And of course, that's abysmally low and incomprehensible that someone could afford any kind of health care coverage at that level. So in 2007, under the leadership of Governor Martin O'Malley, we expanded that to 116% of poverty for parents. And the primary funding mechanism, one of the primary funding mechanisms for that was a $1 increase in the cigarette tax, which you all used here for the CHIP expansion, which is really a tremendous way, I believe, to fund health care. And the history of that in Maryland is we've been increasing the cigarette taxes since 1999, so that now we're the 4th lowest smoking rate in the country. And Larry Couch over there is one of the key leaders in making that happen. So Maryland has used the cigarette tax to reduce smoking and to help fund our health care expansion. So since we expanded health care coverage for parents to 116% of poverty, Maryland has enrolled over 61,000 new parents who weren't eligible prior to 2007 have received coverage under this new health care expansion. And that's people from one end of the state to the other gotten the coverage. And I want to tell you, it has really saved lives. And we are actually putting together a document we're calling Faces of the Newly Insured, which we're going to release this summer, which will detail stories of people amongst these 61,000 whose lives were saved or made significantly better by the healthcare expansion. I'll share with you one story. We've had press conferences from one end of Maryland to the other, just the most recent one with Terry Learman from Steny Hoyer's office in Collier County, Maryland, last Friday. But we've had these events all across the state highlighting the importance of this healthcare expansion in people's lives. In Garrett County, in western Maryland, a woman came there named Crystal Moon. Now, Ms. Moon was like many Marylanders before this law took effect, had no health insurance. Her husband worked, she was a school teacher, she had a couple of kids, could not afford health care, a common story. She went into the local Department of Social Services and asked, can you enroll my kids? I know there's health care for kids. And they said to her, well, thanks to this new law signed by Governor O'Malley, you're eligible also. She didn't know, she signed up. A couple weeks later, she got very ill. She was not feeling well. Had she not had that Medicaid card, she would have done what she would have done a few weeks before, tried to sleep it off. She would have ignored it. Instead, she had this Medicaid card, she went to see a doctor. The doctor said to her, Ms. Moon, thank goodness you came here. You were developing something that would have killed you. But that Medicaid card saved your life. So she came to our press conference, and I have to say, unlike here, in Maryland, our law was bipartisan. We had Democrats and Republicans voting for it, and a Republican delegate from Garrett County was there, and she said to Delegate Wendell Beitzel and all of us these words, thank you for saving my life. And I'm sure that there are thousands of others amongst the 61,000 who would say the same thing. And Ms. Moon's story is how, to us, symbolizes how important the Medicaid expansion is. Now, this passed in 2007, and it was fully funded with a tobacco tax and with some capturing of saved uncompensated care, and the federal match at the time for Maryland was 50%. And then the federal budget disaster happened that you heard spoken about so well. Maryland suddenly was not going to be able to afford this health care for people like Crystal Moon anymore. Luckily, you all did the wonderful thing as part of the federal stimulus package and increased our FMAP coverage. That FMAP coverage allowed people like Crystal Moon and 61,000 others to stay on the health care. And that is very, very important. We need that to continue. As I understand it, there are 30 states like Maryland who are dependent in their budgets through July of 2011, who are dependent on that FMAP 6-month extension to keep our Medicaid programs going. Please don't desert us right now. This FMAP is so important to people like Crystal Moon, but it's also important to the whole economy. Some estimates figure that as much as 900,000 jobs could be lost if that FMAP isn't there to help put money into these states' economies. This is of critical importance to us. But it's not just the parents. We have read studies over the years that when parents are enrolled, more likely children are enrolled. 2 years ago, there were 100,000 children in Maryland eligible for Medicaid or CHIP, but not enrolled. Since our expansion to parents, 85,000 of them have gotten enrolled. 85,000. 61,000 parents, 85,000 children, over 150,000, and some seniors also have gotten health care coverage in Maryland. But my point to you is, keeping that health care coverage for the parents also helps us reach the children who we want covered, who are eligible and not enrolled. So the health care coverage that we enacted in Maryland in 2007, which has worked so well, is only able to survive this horrible budget crisis and recession because of the FMAP, and we desperately need it to continue. Now, you all know that this is important not just for the people on the healthcare rolls, but for all of us. Because let's take Crystal Moon's example. What if she didn't have that Medicaid card, right? And she decided to sleep it off, and then she got this very, very deep illness. Yes, it could have killed her, but it also could have kept her in the hospital for days and days and weeks, running up huge hundreds of thousands of dollar bills, which would have been, she would have had that coverage. She couldn't have paid it. Who would have paid it? All of us. We all know so well this study by Families USA, which concluded that $1,000 of each of our premiums goes to cover the health insurance of the health care coverage of the uninsured. That's a hidden health care tax, which we have reduced in Maryland by covering people like Crystal Moon through our Medicaid coverage with the help of FMAP. So for us in Maryland, it would be a tremendous disaster, and we believe for the whole country, if the FMAP extension ended on December 31st of this year. So we are here to strongly urge, beg you to do everything you can to keep that FMAP extension going for another 6 months. I'd like to quote Dr. Martin Luther King Jr., who said that of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And he was absolutely right. And if he was alive today, he would say thank you to Maryland for insuring Crystal Moon. He would say thank you to Congress for the federal reform legislation. But he would also say, finish the job. Don't drop the ball right now. Keep the FMAP going. And we look forward to you fully implementing federal reform. Thank you very much.